In the annals of medicine, rare cases often illuminate the complex interplay between our bodies and the treatments we receive. These stories, while uncommon, provide invaluable insights into the hidden intricacies of human health and the unforeseen consequences that can arise from medical interventions. This is the story of a 47-year-old man, let's call him John, whose routine COVID-19 booster shot unveiled a dormant threat within his own immune system, tuberculosis. John, like many others, was simply following public health guidelines to protect himself and those around him from the ongoing pandemic. John's case is a stark reminder of the potential for vaccines, while generally safe and effective, to trigger unforeseen consequences in individuals with underlying conditions. It underscores the importance of personalized medicine and the need for healthcare providers to consider the full spectrum of a patient's health history. John's journey began with persistent joint pain, ultimately diagnosed as arthritis. This chronic condition, characterized by inflammation and pain in the joints, had been a source of discomfort for John for several years. He had tried various treatments, but the pain persisted, affecting his quality of life. Seeking relief, he received a corticosteroid injection, a common treatment for inflammation. Corticosteroids are powerful anti-inflammatory medications that can provide significant relief for arthritis sufferers. However, they also suppress the immune system, which can have unintended consequences. Weeks later, John opted for a COVID-19 booster shot, unaware that this seemingly unrelated decision would set off a cascade of events with potentially life-altering implications. The booster shot, designed to enhance his immunity against the coronavirus, interacted with his already compromised immune system in unexpected ways. Shortly after receiving the booster, John experienced a dramatic worsening of his health. What started as mild discomfort soon escalated into severe symptoms that left him feeling debilitated and anxious. He began to notice changes in his body that he couldn't ignore. He developed a persistent cough, night sweats, and unexplained weight loss, all classic symptoms of tuberculosis. These symptoms, which he initially dismissed as side effects of the booster, grew more severe with each passing day. His nights were restless, and his energy levels plummeted. What began as a search for arthritis relief had transformed into a fight against a potentially deadly infectious disease. John's case highlights the delicate balance within our immune systems and the unforeseen consequences that can arise from medical treatments. It serves as a poignant reminder of the complexities of human health and the need for vigilance in medical care. To understand the gravity of John's situation, we must delve into his medical history. John's journey through the labyrinth of medical challenges began long before his current predicament. His medical records reveal a complex tapestry of health issues that have intertwined over the years, each playing a role in his current state. Years before his arthritis diagnosis, John had contracted tuberculosis. This was a significant event in his life, as tuberculosis is a serious infectious disease that primarily affects the lungs but can also impact other parts of the body. Fortunately, his immune system managed to suppress the infection, rendering it dormant. This means that while the bacteria were not actively causing disease, they were not completely eradicated from his body. The TB bacteria, however, remained hidden within his body, posing a silent threat that could re-emerge under certain conditions. Dormant TB can be likened to a ticking time bomb, lying in wait for an opportunity to reactivate. Unbeknownst to John, the corticosteroid injection he received for his arthritis had weakened his immune system. Corticosteroids are often prescribed to reduce inflammation and manage pain, but they come with a significant trade-off. Corticosteroids are powerful anti-inflammatory drugs that work by suppressing the immune response. This suppression can be a double-edged sword, providing relief from symptoms while also reducing the body's ability to fight off infections. While effective in treating a wide range of conditions, they can also inadvertently lower the body's defenses against dormant infections. This is a critical aspect of John's story, as his immune system suppression allowed the dormant TB bacteria to gain a foothold once again. The COVID-19 booster shot, designed to strengthen immunity against the virus, inadvertently tipped the scales further. Vaccinations are crucial in the fight against infectious diseases, but they can also have complex interactions with the immune system. It triggered an intense immune response, which, while generally beneficial, can sometimes backfire in the presence of a dormant infection. The immune system's heightened activity can inadvertently awaken dormant pathogens, leading to unexpected complications. This phenomenon, known as immune reconstitution inflammatory syndrome, occurs when the body's revitalized immune system mounts an overwhelming attack not only against the intended target, but also against previously suppressed infections. This syndrome is a paradoxical reaction, where the immune system's recovery leads to an inflammatory response that can cause significant harm. In John's case, the combination of his medical history, the corticosteroid treatment, and the COVID-19 booster created a perfect storm. His immune system, caught in a delicate balance, was pushed to its limits. The reactivation of his dormant TB infection was an unintended consequence of these intersecting factors. Understanding this complex interplay is crucial for managing his current health challenges and preventing similar situations in the future. The story of John's medical journey underscores the importance of a holistic approach to healthcare, where each treatment and intervention is carefully considered in the context of the patient's entire medical history. TB iris, or tuberculosis immune reconstitution inflammatory syndrome, is a paradoxical reaction that can occur in individuals with a history of tuberculosis. This condition is particularly perplexing because it arises when the immune system, which is supposed to protect the body, ends up causing inflammation and worsening symptoms. TB iris can occur in individuals with a history of tuberculosis who undergo immune system stimulation. This stimulation can be triggered by various factors, including the initiation of antiretroviral therapy in HIV patients, or, as in John's case, the administration of vaccines or corticosteroids. When the immune system is suddenly activated, it can start to recognize and attack the remnants of the tuberculosis bacteria that were previously controlled but not completely eradicated. This immune response can lead to significant inflammation and a resurgence of symptoms. In John's case, the combination of corticosteroid treatment and the COVID-19 booster created the perfect storm for TB iris to develop. The corticosteroids, which were meant to reduce inflammation, paradoxically set the stage for an exaggerated immune response when combined with the immune-stimulating effects of the COVID-19 vaccine. John's symptoms, initially attributed to a lingering cold or flu, raised red flags for his doctor. He experienced persistent coughing, fever, and night sweats, which are classic symptoms of tuberculosis, but can easily be mistaken for other respiratory infections. A chest X-ray revealed the telltale signs of tuberculosis: white spots on his lungs, indicating areas of infection and inflammation. These findings were concerning as they suggested that the tuberculosis bacteria had become active again. A sputum test, which involves analyzing a sample of phlegm coughed up from the lungs, confirmed the presence of active Mycobacterium tuberculosis bacteria, the culprit behind TB. This test is crucial for diagnosing active tuberculosis and determining the appropriate treatment. The diagnosis of TB iris was both alarming and confusing for John. He had thought his battle with tuberculosis was long over, and the idea that it could resurface due to a routine medical procedure was difficult to grasp. He had believed his tuberculosis was a distant memory, effectively controlled by his body's defenses. The realization that a routine booster shot could awaken this dormant threat from within was unsettling, to say the least. It highlighted the complexity of the immune system and the delicate balance required to maintain health. The realization that a routine booster shot could awaken this dormant threat from within was unsettling, to say the least. It underscored the importance of understanding one's medical history and the potential risks associated with immune system stimulation. For John, it was a stark reminder of the ongoing vigilance required to manage his health and the unpredictable nature of the immune system's responses. Treating TB iris is a delicate balancing act. Doctors must simultaneously combat the reactivated tuberculosis infection while managing the overactive immune response responsible for the paradoxical worsening of symptoms. In John's case, this involved a multi-pronged approach. First and foremost, John was started on a cocktail of powerful antibiotics, specifically designed to kill Mycobacterium tuberculosis. Tuberculosis treatment typically involves a regimen of multiple drugs taken over several months to ensure complete eradication of the bacteria. To tame his overactive immune response, John was also prescribed corticosteroids. While corticosteroids had initially contributed to the problem by suppressing his immune system, they were now necessary to dampen the excessive inflammation triggered by TB iris. The simultaneous use of antibiotics and corticosteroids in TB iris highlights the complexities of this condition. It's a situation where doctors must carefully calibrate treatment to address both the underlying infection and the immune system's overzealous response.